Welcome back to Medical and OBGYN News Today. I'm your host, and today, January 13th, 26, we're covering the latest breakthroughs in diagnostics and health. Headline 1. Alzheimer's Early Warning. First up, a major breakthrough in neurology. Researchers have identified a hidden brain activity pattern that could predict Alzheimer's disease years before clinical symptoms appear. Using non-invasive scanning and new AI analysis tools, clinicians may soon be able to intervene earlier than ever before. Headline 2. MIT's Smart Pill. In medical tech, MIT engineers have unveiled a smart pill that wirelessly confirms when you've taken your medicine. The tiny capsule features an antenna that sends a signal minutes after ingestion, then safely dissolves, potentially ending the struggle with medication adherence for high-risk patients. Headline 3. The 10-Minute Cancer Fighter. New data published this week shows that just 10 minutes of intense exercise can trigger powerful anti-cancer effects. The study found that short bursts of activity release specific molecules that switch on DNA repair and can actually shut down cancer growth signals in the bloodstream. Quick recap. Also in the news. For iron breakthrough, a new study suggests a single 4-dose is more effective than daily tablets for treating iron deficiency anemia. Diabetes risk. Researchers have linked common food preservatives to a higher risk of type 2 diabetes over long-term consumption. Exercise versus therapy. Large-scale reviews now suggest exercise may ease depression symptoms just as effectively as traditional psychological therapy. Asterisk it's morning. Joint pains. When you're asleep and still for several hours, the fluid that helps your joints move easily can't do its job. That's why you wake up with knees or hands that are stiff and swollen. To make it better, try to move around more during the day. WebMD. Key OBS and Gynae headlines this month, January 2026. Oral anticoagulants and bleeding risk. A new study indicates that oral anticoagulants significantly raise the risk of abnormal uterine bleeding. Hormone therapy, HT, warning removed. The FDA has removed the black box warning regarding cardiovascular disease and cancer risks from menopausal hormone therapy products, aiming to encourage more personalized prescribing practices. HPV self-sampling. New guidelines and studies support the use of HPV self-sampling for cervical cancer screening, which may boost screening rates and access to care. STI care enhancements. A point-of-care test in the emergency department is enhancing the speed and effectiveness of STI care. Preterm birth disparities. Research highlights that income and race remain significant factors in U.S. preterm birth trends, with higher rates observed in low-income households and among Black mothers. Maternal vaccinations. Studies confirm the protective benefits of maternal influenza and Tdap vaccinations during pregnancy, linking them to fewer infant hospital and emergency visits. Benzodiazepine risks. Use of benzodiazepines during pregnancy has been linked to a higher risk for preterm birth and small for gestational age infants, particularly with second trimester use. AI in prenatal care. The use of AI-assisted ultrasound models shows promise for improving the accuracy and efficiency of prenatal congenital heart defect detection. Recent guidelines and clinical updates. ACOG guidelines. The American College of Obstetricians and Gynecologists, ACOG, has released updated prenatal care guidelines that emphasize individualized care, the incorporation of telemedicine, and addressing social determinants of health. They also released a clinical practice update on new medications for postpartum depression, zuranolone and brexanolone. Preeclampsia prevention. A Cochrane review found that calcium supplementation does not reduce the risk for preeclampsia, reinforcing the focus on early risk identification and aspirin prophylaxis instead. That's your medical news update for today. Remember to consult a healthcare professional for any medical concerns. Stay informed and stay healthy. Don't forget to like and subscribe for more daily health insights. Disclaimer: use the content after verification.